Okay, so the next speaker will be, I think, Ming-Shiang. So I want to just spend a little time just think about, so when I was first starting my graduate, I started my independent research, my mentor, Ron Evans from Salk Institute, called me up. He said, you only do, in this life, you only do one thing, and you want to do it really, really well. I think Dean will really demonstrate that ability from the early 2000, right? So he actually started working on the Pylori already. And the way he did it so unique, as I was saying, this is a great story he want to tell you. He started working on, or study on the little island Matsu. For anybody who actually served in the military, you know, that's a place you don't want to be, right? And he actually went there and did this wonderful study. And from the acid development to eradication now really shows that this H. pylori control can really reduce gastric cancer risk. And this really leads to culminate in the inclusion of detection and eradication action that's covered by the health insurance. Okay, so I know that he's a great storyteller, so I'm going to let Dean to tell the story.
Thank you very much for the very kind introduction. It's my great honor and pleasure to share Taiwan's experience on eradication of Helicobacter pylori to prevent gastric cancer. Yeah, in the discovery of Helicobacter pylori in year 1984 has revolutionized the diagnosis, treatment, and even prevention of gastroduodenal ulcer disease, gastroduodenal disease. And in year 2005, Ming-Shiang and Robin Warren has won a Nobel Prize. This is the first report or discovery of Helicobacter pylori. And after 40 years of discovery, Lancet has published a very important perspective, especially about future direction of after the discoverer has won a Nobel Prize. And ask our team to write a comment or future direction of Helicobacter pylori research. And our comment is toward elimination of Helicobacter pylori for gastric cancer prevention. We write this comment based on our 20 years experience in Taiwan. And we has pointed out several issues for screening and the prevention of gastric cancer. I will use our experience in Taiwan, not only just perform in Matsu Island, but also in Zhanghua and even in indigenous population. Why we point out this is an important issue? Because except in Taiwan, the global prevalence of Helicobacter pylori infection and the incidence of gastric cancer is still high in the world. And antibiotic resistance is a very key issue for eradication of Helicobacter pylori. Traditionally, for example, in Japan, in Korea, they use endoscopy for early screening and the detection of gastric cancer. But this is not so efficient, except in Korea and Japan. Perhaps their endoscopy has better endoscopy technique, just pointed out by Professor Choamo in colorectal cancer screening. There is also the same problem. But I think eradication therapy to prevent gastric cancer is a good choice. This is slide summarized the overview of screen and eradication of Helicobacter pylori for gastric cancer prevention in Taiwan. In year 2004, we initiated a screening program in Matsu Island. And in years 2014, we used tool for 2-in-1. That means we screen stool occult blood and Helicobacter pylori stool antigen in Zhanghua County. And in year 2018, we performed screening or eradication Helicobacter in indigenous community, since they also has a very high incidence of Helicobacter pylori infection and gastric cancer incidence. And in year 2024, our national health insurance cover the cost of screening and eradication. And in year 2026, this become the healthcare policy of Taiwan. Okay, why we initiate gastric cancer screening in Matsu Island? Since Matsu Island has 3 to 5-fold higher incidence and the mortality of gastric cancer than Taiwan's other regions. This is the timeline of Matsu gastric cancer prevention program. When I was a young staff in year 1991, we adopted Japan and Korea methods, use endoscopy to screening and for early detection of gastric cancer. But finally, after 10 years, we find this problem failed. So we begin to change the policy since year 2004. This is me at that time at Matsu Island. We use endoscopy to screen gastric cancer, but the benefit is not so good. Especially we find the majority of gastric cancer found by endoscopy are in advanced stage, not in early stage. So this is early detection of advanced gastric cancer, not early detection of gastric cancer. And however, we use this screening program to build a multi-step and a multi-factorial model of gastric carcinogenesis. And especially, we find Helicobacter pylori was associated with about 40% higher risk of progression in the initial stage of carcinogenesis. And we conclude Helicobacter pylori eradication may be effective to prevent gastric cancer. So we begin the program since year 2004. There's a population screen with urea blast test, and then treat Helicobacter pylori infection. Since antibody resistance is a very important and perhaps the key barrier for adopt such eradication program, so we must know the antibody resistant pattern in Taiwan, and to give an optimal regimen for eradication of Helicobacter pylori. Especially these subjects are usually asymptomatic. So antibody resistance is a very important concern. So we established Taiwan Gastrointestinal Disease and Helicobacter Clinical Trial Consortium with 11 hospitals. And we has a very detailed evaluation of the antibody release pattern in Taiwan. Finally, we have developed our optimal regimen based on clinical trial in Helicobacter pylori Clinical Trial Consortium. And these regimen are adopted in our screening and the eradication program. So we have performed many clinical trials, especially for first-line regimen and the second-line and even rescue regimen. And we perform cost-effective analysis as compared to endoscopy screening. based on the natural cause model and the initial data, the long-term cost effectiveness was simulated. We conclude results support that screening for Helicobacter pylori was more cost effective than endoscopy approach. And this is the intermediate and long-term outcome. Actually, after we start this program, the prevalence of Helicobacter pylori infection in Marshall Islands reduced rapidly from 64% to around 10%. Now, new immigrant is another issue because we find the new immigrant especially can increase Helicobacter pylori. But for those live in Marshall Island, the reinfection rate is very low, below 1%. So we don't worry the reinfection rate. And after 5 years, we find the fatty acid decline significantly and become very rare. It's very difficult to find fatty acid in Marshall Island. And in year 2021, we found 56% reduction of gastric cancer incidence, and 70% reduction was expected in year 2030. And in year 2021, the mortality was declined by 36%. Even there was no gastric cancer deaths in year 2021. The reduction was expected to reach 57% in year 2030. We perform external comparator and the age standardized incidence mortality of gastric cancer in 2021. For Marshall Island, the initial rate was per 10,000 person 50 years before screening, and more than 3-fold higher than other county or city. In 2021, comparison with 21 other counties and the city show that the incidence rate in Marshall Island was lower than the average. We also evaluate theoretical disbenefit, especially some authority worry about alternation in the diversity of gamma iota and the impact on antibiotic resistance. We found there was no significant change in antibiotic resistance, and the gut microbiota diversity will recover after 3 to 6 months. So now the island is the island of longevity. The average lifespan is even better than other counties in Taiwan. So we are still evaluate the impact, for example, for other benefit factor of Helicobacter pylori eradication. So we extension of Marshall Island's experience to Changhua County and the indigenous population. This is the Helicobacter pylori and the gastric cancer map in Taiwan. Actually, Marshall is a high-risk area. And another high-risk area is actually located in eastern Taiwan, in the indigenous population live. And we also select Changhua County. Changhua County is the intermediate risk area of gastric cancer incidence. So we start in year 2014. Since at that time, colorectal cancer has become the most important GI tract cancer for national screening. So we adopt 2-in-1, use stool specimen for detection of occult blood and the Helicobacter pylori stool antigen. So this 2-in-1 program is a randomized control trial. Actually, it's very effective to demonstrate 2-in-1 can decrease the incidence of both gastric cancer and the colorectal cancer. And we also perform cost effectiveness of fecal immunochemical test versus Helicobacter through antigen co-testing. And the analysis actually is also cost effective. And this is for indigenous people. Actually, indigenous people has a high Helicobacter pylori infection and higher gastric cancer incidence. And we use family-based screening. Actually, family-based screening can increase the detection rate of Helicobacter pylori and reduce the reinfection. In year 2024, government determined to cover the cost of Helicobacter pylori eradication. And since year 2026, Helicobacter pylori screening as a healthcare policy will be adopted in Taiwan. So this slide summarizes the milestone papers published in Taiwan. For Marshall Island, we published the long-term result in year 2021 in Gather papers. And for Zhanghua County 2-in-1 randomized clinical trial, we published the paper in JAMA 2024. And for in the indigenous community in 12 county and the cities, the paper was published in 2023 in GATT. And we also do a screening and the eradication of Helicobacter pylori to prevent gastric cancer, international and a global consensus in Taiwan, and has published the consensus in year 2020 and the year 2025. And in WHO also has adopted the strategy of Taiwan and published the consensus in year 2018 and 2016 and 2025. This is the declining trend of Helicobacter prevalence and the gastric cancer incidence in Taiwan. Actually, in Taiwan now, we also observe the decline incidence of gastric cancer. Especially 20 years ago, gastric cancer is just like colorectal cancer, is the third leading cancer death. Now it become 8 cancer leading deaths. And this is a milestone paper published from Taiwan's team, and some become the guideline and the consensus. And we had the 2 Taipei global consensus for screening and the eradication of Helicobacter pylori or gastric cancer prevention. The first is in year 2020. The second is in year 2021, and has also been published in GATT and in the cover page. In Taipei Global Consensus 2, we resolved the controversial issue over Helicobacter pylori eradication, especially antimicrobial resistance and the dysbiosis and even GERD. So in this new consensus, we say that the impact of Helicobacter pylori infection has no influence on the instance of GERD, cancer risk, microbiota, and antibiotic resistance based on our long-term follow-up data in Taiwan, except for gastric cancer. Gastric cancer decreased. And we point out the importance of antibiotic stewardship of Helicobacter pylori. This is the final slide. Now, the experience of Taiwan initially only in Matsu Island, now we have also data in Changhua County and the indigenous population. All these experience point out that screening and the eradication of Helicobacter pylori is a very effective way to decrease the incidence and the mortality of gastric cancer. Thank you very much for your attention.
Well, thank you for this wonderful summary of 20 years of hard work. Okay, this is now open to the question. Go ahead.
Many decades ago, I saw your great achievement. I encourage you to translate your research into policy. It appears that you have made a great job because you are a great lecturer. So we both agree with that the pathogen per se is not harmless. You should eradicate them as soon as possible. Can you give me some advice how to persuade our government or our senior staff that HBV should be also treated as soon as possible?
Thank you much, Professor Wu. I will do my best. Actually, when I was the president of Digestive Society of Taiwan, I emphasize the importance of HBV treatment to further decrease. Now we have some restriction on the drug, just because current drug for HBV cannot eradicate. It's just then remission, but will recur. So, and there are no evidence how long to treat. Helicobacter pylori is more simple, just one time in life. But HBV, the current drug, perhaps there are future new drugs. They can be, just like eradicate Helicobacter pylori, can be treated for a restricted time. Now we must treat for long time. so I think it is somewhat different, but I personally believe treatment of Helicobacter HBV can further reduce the incidence and the mortality of liver cirrhosis and hepatocellular carcinoma. The concept is the same. If chronic inflammation is the basis of cirrhosis or cancer. Yeah. So I will we need to go there. One of the successful studies is we collaborate with public health personnel because they has a more policy maker.
I have one quick question. I think since you're doing this, stool inspection, and you also probably do some microbiota, but I think you should include in microbiota, including the RNA, analyze whether what the microbiota associated with this, stool and all this disease, and that maybe enhance the diagnosis.
Thank you very much for this important suggestion. If we had the budget, we will perform.
I never ask questions because I always ask questions under table. But but today, as a patient of Helicobacter, I'm trying to ask this question and whether there is a way to eliminate some of the side effects that most patients have. I think you all also know that it is very difficult for patients to complete 2 weeks of treatment. Yes. Therefore, there are a lot of modifications. Will there be any ways that you can eradicate much faster without side effects? Because most patients just cannot tolerate 2 weeks of antibiotics.
Very good question. Actually, I will report in another project. Actually, we now find we use proton pump inhibitor in the eradication regimen, the origin. Now we have PCAP. PCAP inhibitor is more effective than proton pump inhibitor, and even 1 week has achieved 90% of eradication rate. We will report the result in another project. Thank you very much for Professor Yang's suggestion.
It is quite annoying to deal with the family members since that have evidence show the family contamination.
Yeah.
How stringent you will recommend it for that?
Actually, when intrafamilial transmission of Helicobacter pylori is very common. Especially we use chopsticks. With your chopstick, we can exchange our saliva, and this is an important route for Helicobacter pylori reinfection or infection. In Taiwan, in Taiwan Island, we do not suggest the intrafamilial screening, but for indigenous population, it's very important to perform family-based screening, or they will get reinfected. I think the diet habit perhaps now has improved in Taiwan. So also in Matsu Island, we do not perform intrafamilial, but actually all the island people are screening. So also so the infection rate or Matsu Island, reinfection rate of Matsu Island is very low.
Thank you. So if any other question, you can ask during the media session, okay? But thank you.
Thank you.
Thank you.